An autism spectrum disorder is a neurodevelopmental disability, meaning that the brain develops a little bit differently over the lifespan. So individuals who have an autism spectrum disorder don't naturally pick up social communication and social interaction skills. Most of you watching this video won't recall how you learned to look people in the eye or make gestures or smile when people smile at you. These are things that just kind of naturally unfold as a product of typical development. So for individuals who have an autism spectrum disorder, when these skills don't naturally emerge or unfold, we need to teach them these specific skills. There is a significant amount of research that suggests that very early intervention, starting within the first few years of life, produces optimal outcomes for individuals who have an autism spectrum disorder. So today I'm going to focus on 3 different sets of characteristics that emerge in early childhood that indicate the need for an autism evaluation. First, poor eye contact in combination with reduced communicative gestures and giving indicate the need for additional assessment. Showing and giving are behaviors that children begin to engage in the first year of life that are largely social in intention. So children will come up and show you toys that they have, or they will give you things that they're interested in to draw you in and involve you in their social world. When these particular communicative gestures are missing or occur infrequently, it suggests the need for additional assessment. The second feature combination is poor eye contact in addition to a lack of imaginative play. Imaginative play includes pretend play as well as our children using dolls or other figures to represent living things. If you don't see these skills emerge by about 18 months, it's time to look for an evaluation. And finally, another set of features to be on the lookout for are intact eye contact, so your child's eye contact is developing typically, combined with repetitive behaviors and lack of giving. Repetitive behaviors can include any behavior that's repetitive in nature. It can be repetitive language, repetitive movements, repetitive sounds. So things like making the same sound over and over, echoing back things that children have heard, or hand flapping, jumping, or spinning. If you've noticed one or more of the symptoms mentioned today in your child, it would be helpful to seek out an evaluation. Also, trust your parenting instincts. If you have any concerns for your child's development, reach out to a specialist. If you live in the Savannah area, Savannah Behavioral Pediatrics is here to help. If you live in another location, you can seek out a pediatric psychologist or a developmental pediatrician who has a specialty in autism evaluation.